Hi, I'm Dr.Krishnan. I'm a senior consultant neurologist at Nano Hospitals, Bangalore. And as you know, neurology is a branch of medicine which deals with multiple conditions which affect the brain and the nervous system. Commonly stroke, epilepsy, neck and back pain, giddiness, the neuropathy, multiple sclerosis, Parkinson's disease, headache, and a host of other conditions. Today I'll be speaking to you on migraine, which is a very important health disease, which is affecting a large proportion of the population. Approximately around 20% of the population is affected by migraine. So what are the symptoms of migraine? Migraine is associated with headache, which could be one-sided, which is associated with nausea or vomiting, and could be associated with a dislike of light and noise during the period of headache. And the headache usually lasts between 4 and 72 hours. So it is very important to identify and treat migraine, because if it is untreated and over-the-counter painkillers are taken over a long time, then the headaches become very chronic and it becomes difficult to treat. So as the headache is early, it is much easier to treat, and the suffering for the patient is also less. So migraine is one such condition in which, if those symptoms which I have elucidated previously, if they are there, then please get in touch with a neurologist and start on regular medicines as per the frequency of the headache. Then the other important health related concern is of stroke. So stroke is a medical emergency. So it is also called as the brain attack. Just like the heart attack is there, so stroke is called the brain attack. And what happens during a stroke is that the brain suffers from lack of blood supply, due to which a part of the brain gets destroyed, or it gets damaged. So depending on the part of the brain that is damaged, the person or the patient who is suffering from the stroke will get weakness of one side of the body, or a difficulty in speech, or difficulty in balance, or a severe headache, or giddiness. So these are the common symptoms of stroke. So if any of these symptoms are there, do remember the acronym or the emergency theme, that is FAST. So FAST, you have to ask the patient to smile. So if the face is turned to one side, then that is a sign. A, that means you ask the patient to lift the arm. If the patient is not able to lift the arm on one side as good as the other, then arm is weak, so that's a sign of stroke. Then S, that is speech. So if the patient is not able to speak properly, so that is another sign of stroke. And if these three are there, then T means time. So there is an emergency there and you cannot wait, so the patient has to be rushed to the nearest stroke center. So if the patient is brought to a stroke center within the first 3 to 4.5 hours of onset of symptoms, then therapies are available which can lyse the clot, which can burst the clot, and then the patient can recover better. So please remember that stroke is a brain attack, it is an emergency, and you should not wait to see if it improves on its own. Thank you.